Hello, everyone. Thanks for tuning in. Today, we're tackling age-related macular degeneration, or AMD. Now, this is one of those conditions where your role as a pharmacist, your counseling, is just absolutely crucial. We're going to break down exactly what you need to know to make a huge difference in your patient's quality of life.
So here's our game plan. We'll kick things off with the basics of AMD, then jump into the modern treatments so you're up to speed on what your patients are getting. From there, we'll get into your biggest impact areas: non-drug counseling, how to handle supplements, post-injection care, and we'll wrap it all up with the key takeaways you can use immediately.
All right, first things first, let's lay the groundwork and really understand what AMD is and why it's such a tough clinical challenge for the people we see every day.
Okay, you've really got to know the two main types of AMD to counsel well. On one hand, you have dry AMD. It's way more common. You'll see these little yellow spots called drusen, and it usually means a slow, gradual vision loss. But the one we really need to watch for is wet AMD. That's caused by these leaky, abnormal blood vessels, and it's the culprit behind the most severe and, importantly, the most rapid vision loss. And this number right here, it says it all. Even though wet AMD is less common overall, it's responsible for about 90% of all severe vision loss from this disease. That statistic alone tells you just how critical it is to catch that switch from dry to wet AMD as early as possible. So, when you're talking with your patients, keep these risk factors in your back pocket. Family history, light-colored eyes, patients can't change those. But hypertension, we can help manage that. And look at smoking. It is the single biggest modifiable risk, making up nearly a third of the risk for vision loss. That's a massive, massive opportunity for counseling. Okay, so now that we've got the basics down, let's talk about the medical side of things. We're going to look at the main treatments for wet AMD because understanding these helps you manage patient expectations and answer those questions they'll have after they've seen the specialist. So, the absolute cornerstone of treatment for wet AMD is a class of drugs called anti-VEGF inhibitors. And yes, these are the drugs that get injected directly into the eye. Their whole job is to block a protein that fuels the growth of those leaky blood vessels, which in turn reduces all that swelling in the back of the eye. And wow, has this field moved fast. I mean, from the off-label use of bevacizumab back in 2005 all the way to faricimab in 2022, the evolution has been incredible. And what this means for patients is huge. It gives doctors more options, and most importantly, it can potentially stretch out the time between those injections. When you look at this chart, the real story for us is the patient's experience. Think about it. Those older agents often meant an injection every single month. That is a massive treatment burden. But check out the newer agents like faricimab. After those first few doses, you might be able to stretch the next one out to 12 or even 16 weeks. That is a life-changing difference. Okay, this next part, this is where you, as a pharmacist, can truly shine. Let's talk about the advice that doesn't come in a bottle, the stuff that really empowers your patients to be a part of their own care team. Probably the single most important non-drug tool you can introduce to a patient is the Amsler grid. It's just a simple grid of lines, but it helps them spot the earliest signs of trouble, like if those straight lines suddenly look wavy or distorted. That can be the first clue that their dry AMD is turning wet. And hey, don't just hand them the grid and walk away. Take a minute and walk them through it. Tell them, put on your reading glasses, hold it about a foot away, and this is key, make sure you test each eye separately. If they see any new waviness, any blank spots, they need to call their eye doctor right away. A simple check once a week could literally save their vision. Now, let's get to a question you are going to get all the time. Which one of these eye vitamins should I be taking? And your answer here is so important, not just for what works, but for what's safe. So here's the bottom line. The huge ARDS2 study dropped a major safety bombshell. They found that beta-carotene, which was in the original ARDS formula, was linked to a higher risk of lung cancer. And here's the kicker. It wasn't just in current smokers. It was in former smokers and even people who had never smoked. And because of that risk, the whole formulation had to change. The ARDS2 formula, which is the standard we recommend today, took beta-carotene out completely and swapped in lutein and zeaxanthin instead. This is the single most critical difference you need to look for on the label. So your counseling here needs to be really sharp. First, always point them to a beta-carotene-free REDS2 formula. Second, tell them to take it with food. That high dose of zinc can be rough on the stomach. Third,
You've got to be careful with patients who have kidney problems because of the high doses of vitamin C and E. And finally, always do a quick check to see if they're taking another multivitamin so they're not doubling up.
All right, what about after the injection? Your patients are going to have questions, and a lot of the time, the pharmacy is their first stop. You need to be ready to tell them what's normal and what's a full-blown emergency.
You can offer so much peace of mind just by explaining what's expected. It's totally normal to have a little bit of pain or irritation, and it's super common to see a little red spot on the white of the eye. That's just from the needle. Let them know it'll probably fade in a week or two and that they can get back to showering and bathing like normal.
But, and this is a big but, you have to be crystal clear about the red flags. If a patient calls and says their pain is severe or getting worse, or their vision is getting worse, or they're seeing a bunch of new floaters and flashes, that is not normal. Those are warning signs for a very serious infection called endophthalmitis, and it is a true medical emergency. They need to call their eye doctor immediately.
Okay, let's boil this all down. What are the most important things you can start doing tomorrow in your practice to really support your patients with AMD? Number one, and I cannot say this enough, relentlessly, constantly reinforce smoking cessation. It's the biggest thing a patient can do to slow this disease down. Every single interaction is a chance to offer help.
Number two, be a champion for the Amsler grid. Don't just mention it, show them how to use it. Make sure they get why it's so important as their own personal early warning system.
And finally, number three, become the go-to expert on these eye vitamins. Proactively check what your patients are buying and make sure every single one of them is on a safe, effective, beta-carotene-free ARDS2 formula.
You know, when you integrate these points, you're not just dispensing a prescription anymore. You're actively helping to manage a chronic disease. You become a vital, trusted member of that patient's care team, and you play a huge role in protecting their sight and their independence.